Hello, I am Usha Kapali, your Nclex instructor at NCLEX Nepal, and today we are here to discuss how to master SATA questions through NCLEX Nepal. Are select all that apply SATA questions making you nervous? Don't worry, NCLEX Nepal is here to help and master your ace the NCLEX exam. Today, I will share you proven strategies to solve SATA question, solve the NCLEX style real question step by step, and show how NCLEX Nepal gives you the best tool to help you succeed. Stay till the end to boost your confidence. Here are the key strategies for SATA questions. Strategy number 1. SATA question follows a point system. That means it is not about all or none. You will be getting 1 point for one right answer. So don't miss the chance. Every right answer can make you succeed. Strategy number 2. Use true or false method. Using true and false method for each statement increases the probability of your answer being right. Look at the question. See if it is completely true or it is not. If the option is partially correct, it is not your answer. Move on to next option. Strategy number 3. Focus on NCLEX principle. That is, either it is regarding to safety, Maslow's hierarchy of needs, or it is ABC, airway, breathing, or circulation. Focus on these strategies. Strategy number 4. Focus on what you know. Don't overthink and avoid finding the patterns in your answer. Like if your answer number A is true and B is true, don't think that number C will be false. Most of the students make this mistake and you should not be the one. Now, let's solve a tricky SATA question. A nurse is caring for a client diagnosed with congestive heart failure. Which of the following nursing interventions should be included in the patient's plan of care? Select all that apply. A. Monitor daily weights. B. Encourage a high sodium diet. C. Assist for worsening of shortness of breath. D. Administer IV fluids rapidly. E. Elevate legs while sitting. F. Educate about low sodium diet. G. Encourage fluid intake of 3 liters per day. Let's take a few minutes to solve the question. Option number A. Monitor daily weight. It is a true statement because a client who is diagnosed with congestive heart failure has fluid retention and it is very mandatory to know the patient's weight. Option number B. Encourage a high sodium diet. This statement is false because sodium causes fluid retention and it will worsen the fluid retention. Option number C. Assist for worsening of shortness of breath. This statement is true because respiratory status should be monitored as congestive heart failure can lead to pulmonary congestion. Option number D. Administer IV fluids rapidly. This statement is false because administrating IV fluids rapidly can cause fluid volume overload. Option number E. Elevating legs while sitting. Elevating legs while sitting can reduce the dependent edema, hence making it a right option. Option number F. Educate about low sodium diet. This statement is true as patients must know about low sodium intake in order to prevent from fluid volume overload. Number G. Encourage fluid intake of 3 liters per day. This statement is false as fluid restriction is done in congestive heart failure to prevent from fluid volume overload. Hence, we have true statement of ACEF making ACEF the correct answer for this SATA. NCLEX Nepal has helped thousands of nurses to pass the NCLEX and you could be the one. To know more tips and tricks relating SATA and other question type, enroll NCLEX Nepal now and pass the NCLEX with confidence. If you want to get more educational videos like this, please subscribe to our YouTube channel.